simple because there's so much for you all to cover. I decided that just giving you an overview, a rough overview of the location and all is more than enough lah, as a part of your introduction rather than going into great details about pathways. But I have prepared some additional slides which I'll quickly go through, but I'll give it to you all for you to read, because I think we have already covered so many things. I know your absorption capacity is going to be very limited. So I'm just going to cover just very core concepts on names, maybe brief things on the function. All right. Where did that go? Let me see whether I'm sharing correctly. Okay, guys, can you see this?
Yeah.
Yes.
Okay, so we will try to wrap up in about 45 minutes. Now, what is the basal ganglia? Now, today we are learning about deep structures within the brain. So, the common important contents of the basal ganglia are the structures called the putamen, the globus pallidus, and the caudate nucleus. And they are interrelated with the substantia nigra and subthalamic nucleus in terms of function. So, when you take a cross-sectional image of the brain, you will find that, okay, right next to the ventricles, this brown area is known as the caudate nucleus. Now, and then lateral to it, inferiorly, is the globus pallidus, which is located between the thalamus internal capsule. You have your internal and outer globus pallidus, and your blue area, which is known as the putamen. Okay. So once again, the basal ganglia components are the caudate nucleus, the globus pallidus, which is divided into the internal and external segment, and the putamen. And they are also interrelated with the subthalamic nucleus and the substantia nigra, which are all related to the function of the basal ganglia. Okay. So the basal ganglia function is varied and complex. It's similar to, it is part, I would say part has a role in the extrapyramidal system, where although not directly relating to the cerebral cortex, it stimulates the brainstem and spinal cord and causes muscle contraction and movement. So basal ganglia structures do not directly innervate these muscles. So when you have a problem in basal ganglia, you don't get conscious weakness, but you have problems with coordination, you have abnormal movement, slowness of movement or abnormal movement that comes in. Okay. So I have previously I made it very simple, so I made it a bit more complicated now for the benefit of all of you. Are you able to see this?
No.
No. Wait. Yeah. Okay. Now. Boleh?
Yes.
Okay. Great. So I added some additional slides now. Okay. So basically, the back to definition. The basal ganglia are subcortical structure. They form the extrapyramidal system, and they work together with the pyramidal and limbic systems to control voluntary motor activity indirectly. Okay, here's a nice picture of the components of the basal ganglia. The red one is the thalamus. Put it in the slide mode. Yeah. This is the caudate nucleus, the head, body, and tail of the caudate nucleus. Blue color is the putamen. Here's the subthalamic nucleus and substantia nigra down here. The pink structure is the fornix. All right. So the 5 areas of the basal ganglia are the caudate nucleus, putamen, globus pallidus, subthalamic nucleus, and substantia nigra. You should be able to remember this, right? In the interest of function, sometimes parts of the basal ganglia are collected together and given names. For example, there's something called the striatum or striatal cortex. The dorsal striatum, which is formed by the caudate nucleus and putamen, right? They are involved in motor coordination and function. The ventral striatum, which is actually part of something known as it's composed of something called the nucleus accumbens and the olfactory tubercle. These are actually a part of the limbic system. All right, which is involved in your reward center. Reward center. There are two different types of. There's simple reward system that goes to the hypothalamus and complex rewards. Like, for example, understanding how if you work, you earn money, and if you earn money, you can buy things that you like that make you happy. See, it's a complex interaction. A simple interaction is you eat food, you get full. Simple reward. And this area, the ventral striatum, is also involved in drug addiction behavior and so on and so forth. So, but basically, the striatal complex, the dorsal striatum, which is formed by components of the basic ganglia, is involved in motor coordination. The ventral striatum is part of the limbic system and is related to reward system, reward center, and addiction behavior. Then you have your globus pallidus and subthalamic nucleus and subsexual nigra, right? So this is another images to show you these structures again. Remember, caudate nucleus, it's got a head, body, and tail. Then you have the putamen outside, the globus pallidus, internal and external, or here they use the word lateral and medial. And then beneath that, you have the subthalamic nucleus and the substantia nigra, which is inside the midbrain. This is a coronal view. So what is the function? Now, the basal ganglia's job is to fine-tune voluntary movement. They do so by receiving impulse from the cerebral cortex. Cerebral cortex says, okay, I'm going to move something. So it also send a note, send an email to the basal ganglia saying, okay, I'm going to move. And this instruction goes through the thalamus, right? And then through feedback mechanism, the basal ganglia will, mediate through the thalamus fine-tuning of this movement, and also plays a role in planning. Modulation means regulating the strength, the direction of movement. You find that the basal ganglia and cerebellum have a lot of common jobs to do and similarly eye movement is affected, and reward process motivation comes from the ventral striatum. Okay, so this is a lot of text for you all. It's put together for you all to read, right? Okay. So striatum, going back to striatum, I've already explained to you the dorsal and ventral striatum. Though striatum is involved, and ventral striatum is the caudate and the putamen, while the ventral striatum is the nucleus accumbens and the olfactory tubercle involved in your reward pathway. Okay, I'm going to give you all this to read. Okay, so we talk a little bit about the caudate nucleus. The caudate nucleus is this big structure, C-shaped nucleus that has got a head, a body, and a tail. Now, what it basically does is it is with regards to integrating sensory information about position of the body, and it sends this information to the globus pallidus, which is the outflow tract of the brain basal ganglia. So it helps to contribute towards things like limb posture and speed and accuracy of your movement. This is one of the jobs of the basal ganglia. So it also does things with things like memory or goal pursued tasks, learning language, fine function, which you have learned before, and keeps it fine. And that's why the integration, this is where integration with sensory component is important, because when you see something, you learn. When you hear something, you learn. So this is part of how somebody tells you to do something, you listen and then you do it. Right? This is the role of the caudate nucleus. Tapping out a little bit, your nucleus accumbens and olfactory tubercle are part of the basal ganglia, but involved in the limbic motor interface. All right. So I have mentioned about the role of the reward circuit earlier. We do things for reward, food, drugs, and even our sexual behavior is related to dopamine, which is the important neurotransmitter in these circuits, and they are, played by the ventral striatum. Then we have the globus pallidus. This is the key outflow tract of our motor system. I'm giving you this to go and read. Don't worry. So I don't want to overload you all with information. But the globus pallidus is in the regulation of smooth precise motor action. This is predominantly motor, regulating the motor information. So input comes from the caudate, from the sensory fibers, and the fine regulation is done by the globus pallidus by two main pathways, the direct and indirect pathways. So before you know about the pathways, you should know the connections of the basic ganglia. So basic ganglia gets afferent input from the brain, cerebral cortex, thalamus, and the reticular formation of the brainstem, and it relays to through the globus pallidus to the thalamus and to the substantia nigra. These are the main areas. Okay, this is a easy way to summarize it all. Okay, and the two pathways in which the basic ganglia work is through something called the direct and indirect pathway. So direct, I mean, they work by counter inhibition and activation. So the direct pathway is basically when there is a it's involved in initiation of movement. In order to make this happen, the direct pathway will carry fibers from the striatum, which is the globus pallidus interna. From the striatum, which is the what do you call it, common and all, to the globus pallidus interna and the substantia nigra reticulata, where we are inhibitory fibers, and then this will inhibit the output from the substantia nigra. So then there's less inhibition on the thalamus. So thalamus activates the motor cortex, and that triggers a motor activity. The indirect pathway involves more steps. That's why it's called indirect. But basically what the indirect pathway does is it has an inhibitory effect on the motor cortex by basically inhibiting the inhibitor of the thalamus. The in-depth understanding of the pathways are not necessary for you all. If you want to go and read, go ahead. But it's how, knowing about these pathways and the receptors involved, GABA, dopamine, D1 receptor, D2 receptor, is part and parcel of how we treat patients with Parkinson's disorder. This is one of the common things, how we replace dopamine, how we put blockers in place to reduce the activity in a particular nucleus group. So, and that's the most interesting clinical correlation of knowing about the basic ganglia is, when you have the function of your basal ganglia is affected, you have problems with planning and modulation of movement, reward processing because of the ventral striatum, decision making. That's partly in relation to our rewards, because we make decision based on what we're going to get out of it rather than. And our working memory and eye movements also have been influenced by basal ganglia, which is involved in modulation. All right. So degeneration of the basal ganglia is known to cause something called a disorder known as Parkinson's disease. I'm sure you've all heard about it. Typically, what are the there's loss of dopaminergic neurons. Dopamine, as you can see in the direct indirect pathway, is an important chemical mediator. So without dopamine, part of the pathway is affected. But the net effect is, here's an example in a brain metabolic PET scan that shows the reduction of dopamine in the brain stem, midbrain and the substantia nigra in patients with Parkinson's. So what do they typically get? They become slow in their movements because the typical modulation function is lost. They are not able to change movement suddenly. That's why they become slow. There's a loss of facial expression. Their reflexes in correcting their posture is not so good. So then they have to have this thing called a stoop posture. They become very stiff and rigid. They get tremors in their hands. All this is because of a depletion of dopamine within the basal ganglia. All right. So the indirect and direct pathways are to the thalamus is affected. So that's where modulatory function of the basal ganglia is lost, and which results in all these constellation of symptoms in Parkinson's. Okay. So I will share those slides with you for you all to read. Please know what are the components of the basic ganglia and basic about the functions. What is the caudate nucleus, putamen, the outflow tract, the globus pallidus, and the subthalamic nucleus and substantia nigra. All right. Okay. Before we talk about the limbic system, I'm going to talk about the insular cortex first, because the last will keep the limbic for the last. Now, the insular cortex. Now, when you look at the cerebral surface, usually you can see most of the areas of the brain, but there is a hidden island of brain tissue located within the brain, outside of the brainstem. The thalamus and hypothalamus, but just below the frontal and temporal lobes. So if you pull the frontal and temporal lobe aside, you will see this island of brain tissue, which is known as insula, and that is insula is the Latin word for island, right? It's a hidden brain, but it's actually a very interesting function. So we will first learn about this is the quick key facts about the insular cortex. It is there are three in total. There's okay, it's surrounded by parts of other lobes, and these are the surrounding areas are known as opercula. So what are opercula? Okay, these areas that covers the island, these are known as opercula. So here, this is the temporal opercula, this is the frontal opercula, and this is the parietal opercula. Okay, so that's what they mean by there are three opercula, and it consists of a central fissure which divides it into anterior and posterior lobe. So anterior lobe, you have the short gyri, anterior, medial, and posterior gyri, and you have long anterior and posterior gyri. So here, short anterior, medial, and posterior gyri, and central sulcus, and then you have a long anterior and posterior gyri. So what does it do? So this is the another image of the anterior and posterior lobe. The three anterior, medial, and short posterior gyrus in front, and the anterior long and posterior long gyrus at the back. That's all the parts. There's no frontal lobe, no temporal lobe, nothing. All right. So what does the insula do? Insula has been shown to be involved in desire, craving, addiction, all right, in our feeling of internal awareness of our body's condition, right? Psychiatric disorders also arise, have been related to, like such as schizophrenia, panic disorders, post-traumatic stress, OCD. These are all believed to come or be related to pathology into the insular lobe and its connection with surrounding brain structure. Let me exit a little while, share some other images with you. Okay, so now we go back to this. So I've shown you some similar images. This is just another image of the insular lobe and where it is located. So when you look at the coronal view, this area is the insular cortex, all right? This is the operculum, frontal temporal operculum, and this is the insular cortex. So function, in risk management, risky decision making, anxiety, interoceptive awareness of our internal self, the internal functions. Homeostasis and autoregulation also come from the insular cortex, and salience behavior. So here is an interaction of some of the processes of the insular cortex. You process sensory processing, all right. Then this information is integrated here. You have a feeling of how is your internal organs going. So sometimes there are patients who have heart problems or who are feeling unwell, sometimes may already feel unwell even prior to the onset of the actual illness because of these interoceptive feelings that comes. But it's a matter of whether we give attention to it or not. It's not always there, but sometimes can be seen. All right. You have your reward and risk assessment, decision making, and of course anticipatory behavior, flexible behavior, to conflict avoidance. All this comes from the insular cortex. It also is, I would say, the insular cortex, what we have learned this morning is a lot of the important systems in our brain, they don't work independently. There's a lot of interrelation with other areas, all right? And the reason for this diversity is cognitive function is not a black and white A, B, C sort of thing. There's A plus 1, A plus 2, A plus 3, There's always variation which changes with our cognitive function, our experiences, and our conditioning. So you need this heterogeneity and complexity in the neural inputs so that our behavior can change in accordance to circumstance and it's not an all or none sort of response. Okay. Don't worry, I'll share all these slides with you, for you all to read about. Okay. So I know you already had a long day and you have a long day left. So I am just going to give you an overview of the limbic system as a last part to the slides, all right? And I'll share all the notes for you with you to go and read, and I'll be happy to entertain questions. I generally feel that there were too many topics put in at one go, but that's how your timetable is, so we have to follow, unfortunately. All right. Okay, so we've talked about basal ganglia and the insular cortex. Now, the limbic system is a complex series of structures that border between the thalamus and the brainstem. All right, they start anteriorly, meaning from the parts of the hypothalamus, the anterior loop of nucleus in the thalamus, the hypothalamus, and then continue on to form the cingulate gyrus of the brain, the fornix here, and you have your hippocampus and amygdaloid body, which is a part of the medial temporal lobe, and the parahippocampal gyrus. Okay, I actually have a very nice video that I encountered that I would like to share with you all. It's just a 2 minutes on the limbic system. Why I prepared this particular video is because I know by this time you all will be exhausted. All right. So at least a 2 minute quick video on this will probably be more helpful. So let me just bring it up for you all to see. Just a second.
Welcome to 2 Minute Neuroscience, where
Okay, guys, I'm going to start sharing now.
Welcome to 2 Minute Neuroscience, where I simplistically explain neuroscience topics in 2 minutes or less.
Can you see
In
this?
installment, I will discuss the limbic system. The word limbic comes from the Latin limbus, which means border, and the limbic system was given this name because its structures lie along a horseshoe-shaped area of cortex. It appears to be a border between the cerebral cortex and the subcortical structures of the diencephalon. There are many processes associated with the limbic system, but the system is most frequently linked to emotion. There is no consensus on the structures that are considered a part of the limbic system, and some argue that it is too much of a simplification to consider something as complex as emotion to be handled by one group of brain structures. Regardless, these are some structures that are often included in the limbic system. The amygdala is an almond-shaped collection of nuclei found in the temporal lobe that seems to be especially involved with fearful and anxious emotions. The hippocampus is next to and interconnected with the amygdala. Although it is considered part of the limbic system, the hippocampus is generally associated with memory more so than emotion. The parahippocampal gyrus is an area of cortex that surrounds the hippocampus and also plays a role in memory. The cingulate cortex or cingulate gyrus is found just above the corpus callosum and is involved in various aspects of emotion and memory. The septal nuclei have connections with a number of other limbic structures and are thought to be especially important to pleasure, reward, and reinforcement. The mammillary bodies are two groups of nuclei that are involved in memory and have extensive connections with the amygdala and hippocampus. The fornix is a fiber bundle that carries information from the hippocampus to the mammillary bodies and then onto the thalamus. The hypothalamus controls hormone release via the anterior pituitary and can exert widespread influence over bodily states to maintain homeostasis. While there are other structures that may be included in the limbic system, the structures identified here are some that are commonly considered part of it.
Okay, guys. Now we're going back to the presentation. So see that quick video gave you an overview of the components of the limbic system, the amygdala, the almond-shaped amygdala in the medial part of the temporal lobe, and then we have the hippocampus and the parahippocampal gyrus, and from there it's connected via the fornix to the mammillary bodies over here. All right, you have your cingulate cord gyrus. This is part of the frontal lobe, medial inferior frontal lobe. All right, and okay, what each of these structures do? Okay, so I give you an example. So the olfactory bulb is the part of the olfactory nucleus that carries information about smell, and how that's how certain smell evokes memories and emotions in us, right? You smell a perfume, you feel nice. You smell an offensive smell, it can make you feel uncomfortable. It can even make you feel fearful, right? The amygdala, now this is involved in meeting body's internal needs. So that's where feeding behavior, sexual interest, emotional reactions such as anger comes from here. Now the parahippocampal gyrus works in tandem with the amygdala, and particularly in response to rage, happiness, or anger or fright, right? The hippocampus is more of spatial relationship, learning, and memory, but how emotion is involved in your learning and memory capacity. That's why if you are happy, you enjoy your learning experience, naturally you will remember more. Moving up, the fornix connects the hippocampus to the mammillary bodies. The mammillary bodies are more, they are a relay station. They transmit information from the fornix to the thalamus. So we know the thalamus is the main relay station where all information comes in, right? Then you have your cingulate cortex, which is also it's involved in modification of behavior to your emotions, right? Okay, this is a recap of what I just mentioned. So what is the function of the limbic system? Now, memory and emotion are essentially tied together. So that's why through the hippocampus, you remember events, and you remember happy events more than bad events because of the emotive component. Emotional behavior. This is our behavior in response to our emotions, anger, fear, including sexual behavior also is part of the limbic system. If you have a malfunction of the limbic system, you can have psychiatric disorders, schizophrenia, depression, dementia, and sometimes if you have a lesion, you can have loss of memory depending on which part of is affected. Now, like for example, in conditions like Alzheimer's disease, there's extensive degeneration of the frontal and the temporal lobe in the hippocampus. So there's a lot of memory loss, and they also lose the emotional response to conditions, right? If the problem is more ventral in your amygdala, then they don't become aggressive. They completely lose interest. But sometimes they also can also lose fear. They become fearless. And this is a kind of a complex psychiatric disorder that you get with limbic system pathologies. Okay, I think what you guys need to know right now is knowing that the limbic system has a role in emotion and memory, knowing the parts of the limbic system to start with. All right, and not to forget that there's also a component of the ventral striatum, which is the limbic system that is involved in reward and addiction behavior. So here's a little bit more detail on the brain networks involved, because it's not just the part of the brain, but how it communicates with each other and how they play a role. For example, the connection between the hippocampus and the parahippocampal region with the rostrum or a retrospinal region is involved in memory and spatial orientation. If you have problems here, you have amnesia, you have cognitive impairment, Alzheimer's, as I mentioned earlier. Now, if it's something affecting the temporal lobe, amygdala, and orbitofrontal cortex that's in front here, the green area, the green connections, it's more of your behavioral aspects is affected, your inhibition of behavior, your temporal memory, your response to smell and memory, olfactory, gustatory, visceral function, and outcome monitoring. So these are some of the disorders you get with this. And lastly, if it's a dorsomedial default network, communication of this, the top here, then your ability to perceive pain, self-knowledge, attention, and empathy is affected. And this area is what results in depression, autism, schizophrenia, OCD, and so on, more of the psychiatric disorders. All right. So I've given you lots of information today. I just want this is just a core recap of what are the things you should be able to remember. What are the 6 lobes of the cerebral cortex? Do not forget the insular lobe and the limbic lobe. All right, also part of the sort of names of lobes. All right, can you list part of the limbic system? Amygdala, hippocampus, phonics, mammillary body, cingulate gyrus. I think this is something I would like you all to explore when you come for the next tutorial. So can we just recap what are the work that I'll be requiring you all to do during the next topics? All right. So one person talks on the cerebellum, right? One group on the cerebellum, one group on the thalamus, one group on hypothalamus, one or two groups on the brainstem and its networks. That's already 5. I want one person to cover on the limbic system. I think basal ganglia and insular cortex, I suppose, how many people do you have in your group, by the way? Guys?
Right now, I think we waiting our class rep to come back to us. I think she needs to talk to you before we create the groups. But we already start discussing.
How many members are there in your batch?
Right now, is my batch is only with 2, but we will see what happens.
I see. Okay, sure.
We haven't.
Yeah, you just get your class rep to contact me, and then after that I will list out all the topics that is required. All right. 40 something. Okay, good. So that means each group can be 2 or 3 people. We don't need to have. So there are a lot of topics I can give you. One bus does on limbic, just a recap, and I want to hear whether your understanding and what we've been relayed to you is okay. Okay. For the function of the brain and disorders, I only want you to focus on visual disorders. That particularly that chart of the visual fields and the visual pathway and the visual field defect that occurs. Everything else is just good for you to know. All right. Okay, so I think I'm going to wrap up for this evening. I think you all have had a long morning. I hope you're going to enjoy yourself. Please write to me if you have any other questions, and then the class rep can liaise with me regarding the what do you call it, assignment that you have during our class in January. All right.
Doctor, thank you so much, Doctor.
Yeah, thank
Okay,
you.
Doctor. Thank you, Doctor.
Sorry, we have to cover so many topics, so I'm not able to. I would love to go into more detail on each of these topics. Yeah. Yes.
Doctor, I have a question. Doctor, just now, Doctor explained about the insular cortex. So, it means that insular cortex located at the right and left hemisphere, or
yes, both sides.
only one
Both
side?
sides. Yes, both sides, bilateral.
Both sides.
Yes.
And then the function is the interoceptive. So is that related the type of the sensory we have?
Interoceptive awareness is more towards.
So this is the type of the sensory autonomy. Oh, okay.
This is not conscious sensation. This is not conscious sensation. This is part of the autonomic system.